Welcome to Dateline Health. This is Fred Lippman coming to you from Southeastern University. And this is a difficult subject area, but we've had so many communications from you, the viewers, relative to the issue of suicide and the behavioral and situational risks that I guess you could say, your questions have been why? Why? Well, so I sort of jumped ahead because we have two guests here who are not only nationally renowned, but in some cases world-renowned in identifying behavioral and situational risks for suicide. And it's a difficult show to do, but I hope that you listen and take some heed to what we're about to talk about. And right in front of me is this is the fourth time he's been with us over the years. Yes. But every once in a while, we just need to get Dr. Gene Cash, Ralph Gene E. Cash, Ph.D., professor and core faculty at the School of Psychological Studies here at Southeastern University. Welcome, Gene.
Thank you. I'm glad to be here.
Good. And another well-known person. See, he's when I said world-renowned, it's really, you're the guy. Peter Caproni, Ph.D. He's an associate professor and core faculty also at the College of Psychological Studies at Southeastern University. Peter, let me start with you. Let's just get right into it. Why? I remember the last program we did with Dr. Cash, with Gene, that we spoke about almost the epidemic of suicides in younger people. Now, we've always seen suicide, I guess, in our lives somewhere, but we've never really ever saw as much in, I think the category was 9 to 18, I think that we discussed. Maybe a different story, whatever. But give us some topical insight into what's going on here.
It's a really tough question, Fred. I think as I reflect upon what the kids that I work with, the students that I work with in schools tell me, I think we're awfully busy now. The kids, the parents, I think back to when I grew up, I had a lot of downtime, particularly in the summer like it is now. We don't build in downtime. We want to keep ourselves busy. And I think that has an effect on our ability to maybe answer some difficult questions in life. These are questions that come up in adolescence and particularly in adulthood. Why am I here? What is my purpose? What is my meaning? If we're really busy, we don't have much time to think about those until they smack us in the face with something like a shooting at Parkland, or maybe somebody passes away in our family, or maybe a child dies of cancer, or maybe somebody dies by suicide that we know.
Well, Dr. Gene Cash, we've discussed this, like I said, prior to this, but there was so much attention to the issue of mental health. What I am saying to you, though, is that we had that discussion. I'm glad Dr. Caproni brought it up. Can I call you Peter?
Sure.
Sure. And it's what he brought up is that there is no downtime. The pressures, we were talking before the show, we took the arts out of schools. We took music out of schools. We take a good amount of the sports and recreation out of the schools. We put so much focus on young people, on standardized metrics, tests, and otherwise. I don't really know. You tell me. Am I in an area that sounds like it belongs in your world of psychological infrastructure studies?
Well, certainly stress is a key issue for psychologists, and the amelioration of stress is a key issue for mental health. Mental health is a key problem when we're talking about suicide. The Surgeon General 20 years ago in the report on child mental health indicated that about 90% of students who died by suicide had a diagnosable mental disorder at the time that they killed themselves. That's still true. The research still supports that notion that most people, particularly most children and adolescents who die by suicide, have an identifiable mental disorder at the time that they die. And that emphasizes to me that one of the only 4 evidence-based strategies for preventing suicide is consistent access to effective mental health treatment.
And when we talk about mental health treatment, let's both get into this, Peter and Jean. Are we talking about a formal, I got to make an appointment to see a psychologist or psychiatrist, or is it really part of the, I guess you could say, the woven blanket of presentation in their early lives, either from the home and or the educational system, or is it both, Peter?
Well, I think one of the most effective things we can do as parents and families is to be good examples to our kids, and particularly in how we handle problems. If the kids see mom and dad maybe going for help in couple counseling if they're having difficulties, that sends a very powerful message. So I think there's much we can do in terms of example of good mental health practices, even before we think about sending a kid to therapy or to a psychiatrist.
You know, I had a conversation about 10 days ago with a superintendent of schools, not here in Broward County, but up in the middle of the state, who I happened to come across at a meeting. And we were talking about how so many young people are placed in a realm of being ADHD, all kinds of acronyms, and a lot of it has to do with the inability for us to recognize that some kids can't see a blackboard, for example, or some kids are dyslexic, or some kids have a hearing issue. And the first thing that happens is the underpaid, I'll say that. That's the only item I'll say about school teachers. They are underpaid. But they're sitting in a classroom and they got 20 to 25 kids in a room, sometimes more. Usually more. And there's some disruption. And they don't know what to do, so they remand the issue back to the parents.
I'm concerned not only about overdiagnosis of various kind of problems, but also the underdiagnosis and the undertreatment. I think they're all a function of how much we are able to individualize our attention to kids in the educational system, and how much collaboration that we have with parents and with outside caregivers. If we're not putting the money to education to make smaller classes and smaller schools, then you cannot individualize. If a teacher has a classroom of 15 people, she can do, or he can do, a lot more in terms of individualized, differentiated instruction. We go to 30 and 35, it's humanly impossible to do that.
Gene?
Well, I think that Pete's right, that not only do we sometimes over-medicate and maybe over-treat, although when treatment is used broadly as including psychotherapy, I'm not sure that that's the case. But we often over-medicate. But that's not a problem just of youth. That's a problem of our entire society. Our entire society, with the opioid crisis, for example, seems to take it as axiomatic that if you have a problem, you take a pill. And that's not always the best way to deal with those problems. That's not always the best way to treat mental health issues. There are some mental health issues that require medication. There are other mental health issues that are better treated with, well, to use the term loosely, talk therapy. And most mental health issues that require medication also require talk therapy. It's generally a mistake just to prescribe medication for a mental health issue.
Is that a behavioral compounding issue or a situational issue that perhaps involves the non-view of mental health needs? What is going on?
Well, tough question, but a very important one. And let me address it in a different way. That is about the complexity of society. Our society has become increasingly complex. Interesting that the suicide rate, that is the number of suicides per 100,000 people, has not changed very much since 1900. The way in which it has changed is that our youth are much more vulnerable now and much more likely to die by suicide than the older folks. It used to be that if you were most at risk if you were a male my age. Now, it's shifted so that you are more at risk if you're a child or adolescent. Why? Because the society has become so complex and so disposable in a way that we have created an adolescence to try to cope with that. In primitive societies, there's no such thing as adolescence. Once they become sexually mature, they go through some kind of ritual and enter adulthood. Not in our society. Adolescence keeps expanding. Now, somewhere mid-20s, that's when auto insurance goes down. That's when now you have to get off your parents' insurance, health insurance, and so forth. And as a result of those stressors on our youth are dying at alarming rates by their own hands. And that's particularly true in the last couple of years for females. Females have always attempted suicide about 4 times as often as males. However, males have tended to die by suicide about twice as often as females because they choose more lethal means. More recently, our young girls are choosing suffocation or strangulation by hanging or plastic bags rather than overdose, and therefore they are dying at a much higher rate. It's because of the stressors that have accumulated for our youth and the rapid way in which technology is changing them and changing their interactions with other people.
Peter.
I want to tap into 2 of the questions you asked. One, the relationship between our frenetic current society and what you describe as not talking about mental health issues back in Brooklyn, and for me back in Ripley, Ohio, in Appalachia. I think there's a relationship there that is relevant to what we're seeing today. In our day, we had extended families. We had family support that was available to us as we encountered problems in living. We could talk to people. We had groups of friends, okay? It didn't matter at that point whether mental health was anathema to talk about because we were dealing with those issues. I think that's one of the things that's changed today. We don't have those extended families. We have a great deal more mobility where people are in a different state than they grew up in. And so you don't have the natural supports available. And that's why I think we need more professional mental health supports today, because we don't have that kind of network, that village that Hillary Clinton talked about that we had at one point in time.
Is that what we're talking about? Is it that we've lost that extra connection with people that live within our neighborhood and within our cultures? Is that what's happening?
Well, think about where we live. We live, many of us, in a suburb. I live on a cul-de-sac. How well do I know in the 4 years that I've lived there the 5 neighbors around me? It's very different than when I grew up in Ripley, Ohio, and I knew most of the people in my town of 2,000 people.
Yeah.
So our lives have changed. We don't sit out on the front porch in the evening and talk about things. You remember in Brooklyn? I'm sure they're on the stoop.
Yeah, on the stoop, and I used to go to what they used to call candy stores, where they used to sell newspapers and I guess you could say school supplies and things of that nature, and ice cream and stuff like that. But whatever, I mean, it's just, again, I don't know whether we're giving the folks the answers. But let's try to enumerate. Some of you, both of you, have said it. But what are the situational risks that we got to keep our eyes open for?
Well, are you talking about for suicide
For
specifically?
suicide, yeah.
The situational risks are multifold. First, there's a genetic risk. That is, there are some people who are born with a genetic vulnerability to certain kinds of mental disorders like depression and anxiety and mood swings and so forth, who are going to be more at risk eventually for dying by suicide than those people who don't have that genetic risk. Secondly, there are risks that are associated with what are called adverse childhood experiences, or ACEs. The more adverse childhood experiences that a person has, and those can include abuse of some kind, they can include bullying, they can include school failure, they can include a lot of different things that traumatize children, including school shootings, although those are rare and schools are generally very safe places. Those adverse childhood experiences seem to build up. It's not just a matter of you have one and now you're vulnerable. It's the more you have, the more vulnerable you are to some triggering incident then. And that triggering incident may be a trauma that one experiences in adolescence. Let's say the loss of a boyfriend or a girlfriend, a parent's divorce, or something like that. That may trigger the vulnerability that was already there because of genetics and or environmental circumstances, thus tipping the person over the edge, so to speak. And since they may not have developed very effective problem-solving and coping skills, their solution to the distress that they feel that seems unmanageable and interminable is to die by suicide.
Peter.
So let's think about the example that Jean gave of someone who has some vulnerability built in and experiences that trauma in adolescence of losing your first boyfriend or girlfriend. What do? What could be a protective factor for them at that point to prevent them from moving down the road of having ideas about suicide, maybe planning and actually trying it? Connections to other people. The research indicates that family connections, even in adolescence, when we think about kids sort of moving away, it's those family connections that are one of the most powerful preventative or protective factors to prevent suicide. Relationships with friends is also important, but interestingly, not quite as important as family.
That's, I guess, but you know, again, we talk about, at least in my world of youth, we always talked about the extended family, which was not only the cousins and second cousins and whatever, sometimes even more than that, but also their friends, that if we went to someone's home,
yes,
the friends were there along with the cousins and the aunts and the uncles. Is that what we're talking about?
That's what we're talking about, yeah.
Right.
Yeah.
And Thomas Joyner has a theory about the things that lead to suicidal behavior. And those things, there are three of them. One of them is hopelessness, the sense on the part of that individual that he or she has no future, that nothing can save them, nothing can get better. That sense of hopelessness can come about as a result of some of the factors we just discussed. Then there's also the sense of burdensomeness. That is, people would be better off without me. I am a burden to my family, I'm a burden to my parents, I'm a burden to my friends, I'm a burden to my teachers, and so forth. And the third one is the capability for self-harm. A lot of people think that Joyner is right, that, for example, the teens who cut themselves are practicing for suicide. Whether that's the case or not, it's certainly true that people have to develop, I'm reluctant to call it the courage to kill themselves. I guess the best way to describe it is the way that Joyner does, the ability to die by suicide. And those three things together are a terrible trio.
So I would assume that both of you feel that, you know, we're here part of the Nova Southeastern education family community, that there's student population here that you have responsibilities for, educationally, giving them some sense of of understanding as well as a sense of command of their own emotions, their relationship to you as mentors. We see a lot of stress in education, but I think we here, at least, I mean, I don't want to step out of my area, but we seem to have some feeling towards what you just said, Gene. Am I right, Peter?
Well, in the 8 years I've been part of the NSU family, actually 3 more years as a part-time adjunct faculty member, I have really been impressed with our ability to individualize and to pay attention to self-care in terms of our students' welfare. I think it's one of the things that, being a smaller program, we're very much able to do. One of the competencies that the American Psychological Association requires us to teach and to support is that of self-care. And truly, as a psychologist, how well can you take care of somebody else if you're not taking good care of yourself?
Well, we're down to the last 4 minutes of the show, so I want to ask you to put up the red lights. In other words, identifying behavioral and situational risks. We've been through it, but let's get to the top issues, if you don't mind. Mm-hmm. So I'm going to start with you, Dr. Peter Caproni.
Okay, one of the things that we have to really be careful of, and this goes back to Joyner's idea of a person's capability of suicide. Does a person have knowledge and means to attempt suicide? So as a parent, we can really take hold of that by making sure we don't have firearms in our home, for example. That's a clear kind of thing that we can do, because that's a very lethal means of suicide, and we don't have to have it in our home. Some of the other things, I think, are building in those protective factors of regular communication with our kids. If we see our kids acting differently, if our kid is starting to sleep more or sleep less, or eat more or eat less, or grades start to go down, or isolate themselves, any of those kind of signs, we can pay attention, we can jump in. It doesn't hurt to say, are you feeling bad about yourself? You know, have you ever thought about trying to hurt yourself? We want to know that rather than assume.
Dr. Cash?
Well, I think that there are 4 things. I mentioned earlier that there are 4 evidence-based approaches to suicide prevention. And so we should, at this point, base our efforts on the evidence. One of those things is education. That is, we need to educate students and faculty members and people in the workplace and families about the risks of suicide and how to ask effectively. It really is important that people learn to ask, because you can't tell without asking. That is, do you feel like harming yourself or killing yourself? That directly. If we ask, very often we'll get the answer, no, I'm not feeling like that, or how did you know? Thank you. Second thing is that we need to train gatekeepers in businesses, in schools, in universities, in society in general, to recognize the warning signs of suicide and to know what to do about that. The third thing is to make sure that those people who need mental health services because of our screening processes and our gatekeeping get them, and get them effectively. And the fourth thing, as Peter pointed out, is to remove lethal means when a person is deemed to be suicidal. And I don't necessarily agree that you don't need guns in the house. That's an individual decision. But you need gun safety in houses. Otherwise, kids will find them, and they may hurt themselves or someone else.
I know this has been a very difficult subject, because especially after the Parkland issue and you know, we do a show every year with the Humane Society of Broward County, and they do a lot of, you know, relating issues relative to their therapy dogs, you know, and as you well know, and there's a lot of reasons why these factors all have to be looked at. So I always urge the people to, or the viewers, to, you know, get involved. You know, that doesn't mean you have to, you know, pay dues to something or whatever. You know, sometimes in a school, somebody wants you to raise your hand to distribute cookies, or to bake cookies, or whatever, or to help out on the sports field or something like that. I believe there's a connectivity between the children that perhaps are your children or neighborhood children, and they see you. It gives them a sense of comfort. Like I said, the people have asked about these behavioral and situational risks, and I know why. I mean, with the multimedia environment that we live in, 24 hours a day, something happens, and people don't understand it. And all they want is some sense of understanding. Mm-hmm. They don't want any complicated scientific, answers. But I believe that both of you presented, both Dr. Caproni and Dr. Cash, you both have presented what I would call common sense answers to some very difficult issues. So I want to thank you both for being here. Like I said, it's a difficult subject area to discuss, but I hope the viewers got some information and some, I guess, ideas of placid thinking by saying, gee, Dr. Cash, Dr. Caproni, they said this, and maybe they'll pass it on. I hope they do. Folks, we want to thank Dr. Gene Cash from Ph.D., obviously, professor at the College of Psychological Studies here at NSU, and Dr. Peter Caproni, also a Ph.D., also with the College of Psychological Studies. You're a blessing to our institution, but to the community at large. I've always said this to you, Dr. Cash, that as a mental health advocate, you ought to be blessed. And we'll put you in that category too, Peter. So thank you both for being here today. Sure. And hopefully, folks, that we gave you information that's of value. And remember, be on guard. And I always tell you for yourself, I ask you to please stay healthy. Therefore, I want you to communicate with your doctors. If something is bothering you, talk to your doctor. You're going to see the doctor one way or the other. Whoever it is, talk to your pharmacist, talk to your dentist, I don't care who it is, but let them know, because that way you stay healthy. This show comes to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.